morning and welcome to Our Issues Milwaukee. I'm your host, Andrea Williams. Our focus this morning will spotlight several of our city's new leaders. Last year, Milwaukee's Common Council unanimously voted to confirm Dr. Jeannette Kowalik as the city's new health commissioner after she was selected by Milwaukee Mayor Tom Barrett. We're happy to have Commissioner Kowalik join us today on Our Issues Milwaukee. How are you?
I'm well. How about you?
I'm doing well, and I appreciate you coming by today. What we like to do on this show is not only really talk about the issues, but give the viewing audience an opportunity to know more about you, the person. So you have a Bachelor's of Science in Healthcare Administration from UW-Milwaukee, a Master's in Health Promotion from Northern Illinois University, and a PhD in Health Sciences from UWM. So quite a background. I think what's most impressive is that you are a native of Milwaukee, and you actually came back to the city in order to take this particular journey. So tell us about all the things that you've done that have led you to where you are today.
Yeah, thanks for asking. So I'm the youngest of 12, definitely a very large family, a very diverse background. Growing up in Milwaukee, I experienced many challenges which helped me to become resilient in the position that I have now. At one point, I had a son while I was in undergraduate school, and I was able to make sure that I continued my studies thanks to the support of my son's father's family as well as my own family. So I didn't take time off once I had my son. I was able to continue my studies throughout the entire way. So I did that, and I also got my first full-time job at the Milwaukee Health Department in 2004 as an environmental hygienist. So I was in the field. I actually went out with lead risk assessors, so I was able to see some of the conditions at that point in time. Little did I know that lead would be a front and center issue for the Milwaukee Health Department, which prompted my return in 2018.
All right. So you have mentioned that the challenges of growing up here, which would include poverty and then having a single mother.
Being a single mom, yep.
Yeah, really, does that allow you to really relate more to some of the other challenges that people who live in this community may face on a daily basis?
Absolutely. So again, my son was born when I was working on my undergraduate studies, so that meant I didn't have the resources or income. You know, I wasn't able to work full time. I didn't have the education or training to be able to get jobs that would provide a better salary. So I worked part-time. You know, I was on welfare. I had a Quest card. I was on WIC. I lived in Section 8 housing. I remember when I first moved into my first apartment, it was a Section 8 property in President Hamilton's district now. And my first month's rent was $25, and I literally did not have $25 to pay the rent.
Wow.
So I had to scrape up change and sell CDs or whatever I did at that time to be able to have the money to move into that apartment so I could have a place for my son and I. So I do recognize and recall those experiences very well. Me moving into public health as a career was a very pivotal moment for me as a young woman, a young black woman, because I was able to get out of poverty and get off of welfare. The job that I got at the Milwaukee Health Department, once I got that job, once I got that offer letter, literally like 2 weeks after, I went to my caseworker, my W-2 worker, and submitted the paperwork to cancel my case. And I remember how powerful that was. Even a young lady that was standing in line with me, and she was like, I never saw anybody do this before. And now you've motivated me to want to do this too. So I was like, okay, this is what I'm talking about. we can do it. We can move forward. So.
Yeah, and you have said that, you know, aside from being the health commissioner for the city of Milwaukee's health department, you want to be a mentor and a role model. So talk about ways that you've thought that you can do that. And that would include you sharing your story. I'm sure that motivates a lot of people in itself.
Yes, absolutely. So I wouldn't be where I am at today if it wasn't for people that believed in me and lifted me up, especially the moments where I was low or where I felt alone. My faith definitely enabled me to move forward and to overcome any obstacles and challenges. But there were a number of individuals along the way throughout my life, male, female, that really helped me to move forward and gave wisdom and encouragement in times of need. Too many of those, I have too many to name, to be quite honest. I mean, it definitely was like a crew of individuals over time, but when the opportunity came about for me to return home last year, there had to be at least like 30 people that were reaching out. Some of them didn't even know that they were connected in various ways. People I've never even met before that were rooting for me and advocating for me to continue to press forward, not to give up, that they were very adamant about me coming home to serve because they felt that I would be the best person to move the department forward.
Okay, and speaking of moving the department forward, it's no secret when you were hired, you automatically inherited some pretty serious issues that have to be contended with, mainly the situation regarding lead. So about a year ago, it was learned that the health department failed to follow up with families of thousands of children across Milwaukee who tested positive for lead. So how have you begun to deal with this specific issue?
Right. You know, sometimes when opportunities come about, we have the choice to either jump in or to pull back and wait for someone else to clean it up. That was a huge point of mine, that I knew that I had the wherewithal, the skills, the stability, the emotional maturity to be able to move into this space and help the department to move forward. And I say that because I started out as an intern and then I moved up through the organization, so I know how it feels at the very base level or direct service level, and then eventually into management, and now coming back as the commissioner. I noted that I started out as an environmental hygienist, so I was out in the field with lead risk assessors and being able to see some of these properties. So I felt very compelled to come back home to serve because, you know, I had also learned too that I left Milwaukee in 2012 and now I'm back, that the state of affairs, I mean, Milwaukee has wonderful development, you know, Pfizer, you know, a lot of opportunities, but there's a lot of people that are being left out and a lot of people that are struggling to be able to afford housing that's lead safe. And, you know, what are we doing about these? These rents are going up and the quality properties are out of reach for many people. So being able to address this from a public health perspective, like if a child has an elevated blood level, the health department is obligated to notify them. There's a relationship between the providers, the clinical providers, as well as the health department. They have to report that a child has lead poisoning, so then the health department has to notify the parent and link them with the resources. Now, as far as like a home visit, whether it be a nurse, a lead risk assessor, that whole rest of that process, that is contingent on what the blood level is. If it's elevated, extremely elevated or not, there's different features that are tied to it because, you know, we have limited resources. So if a child has like a 2, EBL of a 2, we can't necessarily afford to send a nurse out for every single case that's a 2. We'll send out a notification, a letter, or something to that effect. But when the blood lead level is higher, then that warrants different levels of care. So that's one of the points. But the failure of the health department then not to notify, even to send out letters, is just very disturbing. That it's a very basic feature. And, you know, I know that now, you know, we are where we need to be, but we're not fixed. It's going to take time to get out of the hole and get to a better place. Part of the issues with the lead program, as of today, we are still recruiting staff. We still need enough staff to be able to do the work. The mayor's office and Common Council have committed additional resources so that we can have more staff. The other part of this too is if a family qualifies for abatement or getting the home fixed, there's various functions of that. Either can be funded by block grant money or HUD money. And last year we received a notice from HUD that we could not use HUD grant money to abate properties. Right. That's what this stop work order is about. You know, it's like the last resort from a federal agency before they pull your money. And it's meant to give you a warning like, look, you're not following the guidelines. Let's get it together. Let's do a work plan. Let's micromanage your ability to be able to address this. And then the order will be lifted. because the government shut down on the 28th of December, that impacted our ability to receive our stop work order notice that it was being lifted. So we're still waiting for that. I know they're still catching up.
Okay.
But that's just some elements there related to different funding sources that are used to help fix the property. And then the other side is who fixes the property. We have contractors, right? The city is in need of contractors. The contractors have to complete various trainings from the state to be certified to do lead abatement, to make sure that they're not spreading the hazard or making it worse. So we're putting a call out to contractors, especially contractors of color, diverse contractors, that we need you, the community needs you, so please consider getting your lead abatement certification so that you could be a part of the pool that will be used to fix these properties.
Okay, and just know that you are welcome to come back here anytime as you reach each of these steps to help get the word out of what it is you are trying to accomplish. You have vowed to establish a board of health, and so before we run out of time, I definitely want you to talk a little bit about that.
Yeah, so yesterday the Common Council approved the resolution for the Board of Health. So yesterday was my 5th month on the job, so I'm very happy that with 5 months in, that Board of Health is going to become a reality. Alderwoman Shantia Lewis was the champion behind that during the interview process. So this is like May of last year, where we discussed this, and I said, you know what, I honestly believe the problems at the health department would not have occurred if we had a Board of Health, like other large, top
like that
cities.
Checks and balance in place. Yeah.
Like a nonprofit, you have a board of directors, and then you have, your ED or CEO. The Common Council is responsible for everything. Like the Fire and Police Commission, they have a group specifically that addresses fire and police issues. So the Board of Health is a natural fit and a need for the Milwaukee Health Department. So there will be 9 individuals. The mayor will nominate, so please look out for the opportunity to nominate, whether you have someone in mind or you yourself would like to be a part of the Board of Health. And then the Common Council has to confirm the nominee. So it'll be a 2-step process. And once that's all done, then the Board of Health will convene and they'll meet on a quarterly basis.
I think that's good news. And we are quickly running out of time, but of course, what has been an issue health-wise for Milwaukee for many years, even though we are seeing the numbers change just a little bit, is infant mortality. And most of the cases that we hear are due to unsafe sleep-in environments. So with that in mind, and also with the rising numbers of STIs, are you interested in collaborating with other professionals in the health industry, as well as organizations, in helping spread awareness and tackle these issues?
Yeah, and I want to shout out Alderwoman Malele Cox, because she advocated for additional money for the health department to look at African American infant mortality, and using community health outreach workers such as doulas that would provide specific care to be a liaison between the community and the healthcare professionals. So that's a huge resource in other communities, using doulas, and then promoting breastfeeding and other holistic approaches have proven success. So we want to look at what's happening in other markets and see if there's opportunities to expand what we're doing here. There's other organizations like Maroon Calabash and Unite Milwaukee and some others that are doing some innovative work related to reducing infant mortality. So I have a long list of individuals I need to meet with, and definitely with some of those that I haven't met with, but I'm all about collaboration and partnership. So I'm looking forward to meeting others that are interested in doing this. We have to do this work together. We can't just be in silos. That the past has shown that doesn't work. So
yeah, we all know it takes a village, no doubt about it. And 5 months on the job, so you have your work cut out for you. There's no doubt about that. But we really appreciate you coming by and shedding light on where we are dealing with specific issues. And welcome home.
Thank you.
It's been a pleasure talking to you. Dr. Jeannette Kowalik is the newly appointed Health Commissioner for the Milwaukee Health Department. For more information on anything we've discussed, you can visit city.milwaukee.gov. When we return to Our Issues Milwaukee, we'll catch up with Milwaukee County's newly elected sheriff. We'll discuss his goals and find out how things have been going during his first few months on the job. We'll talk to Sheriff Ernell Lucas right after this.